Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health-related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease-free life. To help us in this regard, we'll be joined by eminent and expert top doctors from across the country. Hello, this is Aprajita Mehra, and you are watching Medicircle. Today on our AIDS Awareness series, we have Dr. Phanender Ketha with us. Dr. Phanender Ketha is a pulmonologist and HIV specialist and has experience of more than 25 years. He was awarded MBBS degree from Andhra Medical College. He has been awarded by Dr. Vyagra Swaradu Memorial Gold Medal for the Young Scientist. He was also awarded Achiever of India Gold Medal for his representation at the international level. Also, Vikash Ratna Shiromani Award from SFNU. He was also feted as Pulmonologist of the Year 2021, Andhra Pradesh by Asian Healthcare Research and Media. He is also a member of IMA and AIDS Society of India. It is our, real pleasure and privilege to host him today on Medicircle with us. So welcome to Medicircle, Dr. Phanender Ketha. How are you, sir?
Yeah, fine. Thank you. Thanks a lot. Good evening.
Good evening, sir. So my first question to you would be, Doctor, how is AIDS transmitted from one person to another?
Actually, it is a very basic question, but people are forgetting about HIV and AIDS because we have really had very, very tough time during the 1986 to 2000. And in fact, by 2002, that is 20 years ago, I am almost the first person to start the antiretroviral therapy in Andhra Pradesh. Second only to another doctor from Delhi. Because the government has not yet initiated the ART at the ART centers. So it was done by me, being a fellow in HIV medicine from CMC Vellore. I had a keen interest to start such treatments. Okay. So later to that, in 2004, government has initiated ART centers, and then people are given the rolling of AIDS treatment. Okay. Yes, and as far as this question is concerned, HIV and AIDS, how it is transmitted, mainly two routes, madam. It is through sex and blood. So blood means blood transfusion primarily, and it is very important source, but licensed blood banks do never able to transmit. And nowadays we are having RT-PCR testing, that's called a NAT testing, nucleic acid amplification test, which will be able to detect by PCR method, able to detect any HIV presence of the virus in the blood of the donor within 4 days, 3 days to 4 days. So by that way, the window period is very much reduced. Right. Earlier, there is a problem as far as the blood transfusion is concerned. Sometimes the donor donates the blood, and at the time of screening, it is negative, and after 10 days or 14 days, it turns positive. So that is the practical problem. There was no solution for that until recently. So until recently, once we have the PCR testing or the NAT testing, this problem is solved. But this problem is solved in the developed countries like anything. And so unlicensed blood banks are only the one which will transmit the virus in this means, that is through the blood transfusion. And as far as the second route is concerned, it is a sexual route. This is the most common route. So it is from the vaginal sex or from the anal sex. So vaginal sex is better when compared to anal sex. Anal sex has a more risky situation because the rectal mucosa is much thinner, and the tear or the mucosal tear can be an important reason for the transmission. So whereas the vaginal sex, the exchange of body fluids is more for the recipient partner. So once there is a recipient partner, the recipient partner has a more exposure of mucosa and hence more risky. So the female partner is more risky, getting transmission of HIV from the inserting partner. Similarly, even in the anal intercourse also, the recipient is having more risk than compared to the inserting partner because of the exposure of more surface area of the particular recipient. Okay. So with this, these are the two important things. The other things are we are having needles and syringes as the causes, ear nose piercing or the ear piercing for the girls, and sometimes the chewed food, pre-chewed food. That means infants are there. The caretakers are generally they chew the food and again feed the infant because if they are so loving and then they are taking care. These are the practices generally do happen, and other ones are like tattoos. And so these are the risky things. And the next important, though we tell about all this, they are less risky when compared to the first two things which I have mentioned, like blood and the sex. And the most important again is the mother to child transmission. That is what that is called maternal to child transmission. There is a prevention program designed by the government. That means the mother is given treatment if at all there is HIV detected with her, and the child is also given treatment. So the mother to child transmission occurs at any time, like during pregnancy or during child delivery or breastfeeding. So these are the three occasions where there can be a chance for the transmission of HIV from the mother to the child. So these preventive things, the government has adopted a very good protocol wherein that program has become 100% successful in almost eradicating the HIV in the newborn. That means the female, all the pregnant women are screened for HIV.
Yes,
They
absolutely.
are tested for HIV. They are
Along
tested
with
for
all
HIV
other
in the
important
antenatal.
tests. Yes.
Yeah. So they have screened them, and if they're found positive, they don't worry. They give treatment. So once you give treatment, the viral load comes down like anything, and hence the chance for transmission from the mother to the child also decreases. The second step is during the delivery. At the time of delivery, the child is exposed to the fluids of the mother. So they are at risk. So to avoid or to lessen or to stop that exposure, we have a modified cesarean section done. So if the mother is done the modified cesarean section and delivered the baby has almost no chance of getting HIV from the mother in this regard. The third step is from the breast milk. So though we advise breast milk, sometimes we may ask them to stop breast milk. But the other way around, we are also giving nevirapine syrup for the child for 6 weeks. So even that will prevent the transmission from through the breast milk. So by that way, the transmission rate has become less than 1%. So almost
And
there
that's
is
absolutely commendable feat compared to
this
what
is
AIDS
yes,
was
this is one of
feared
the
for.
most important
Yes.
success from the
Yes.
government program. Yes, all over India, this is the good, very
Yes.
well implemented program, and it has turned into a very great success. So now we can say that the HIV-free generation is born. So nowadays you don't hear about a girl born with HIV. Earlier that was the problem. So now this is one of the greatest achievements as far as we are concerned. So, and day in and day out, all the scientists have worked well and they have designed very patient-friendly medication nowadays.
Absolutely.
So, as far as the innocent children are concerned, I have to put a point. So, there are still practices for ear piercing and nose piercing for the girl child, and tattoos as for some fashion or something. And these are the again risk type of activities for HIV. And sometimes, as we all know, that kissing is not a big issue, but people who are having ulcers, aphthous ulcers means some B complex deficiency will be there, and they have some cracks in the mucosa of the lips or the tongue or elsewhere. So those will be transmitting the HIV. So in that case, even the kiss is also risky. Okay. So social kissing, hugging, and shaking hands, eating food in a combined way, and sharing the toilets does not transmit the HIV. So these are the methods for transmission of HIV.
And
you can ask
Doctor,
any.
yes, and I think, Doctor, you have very commendably, tried to bring out everything in our notice right now.
Yeah.
So
Yes.
let us quickly move to the other question, which is at what stage we can get cured from AIDS, if at all we get cured from AIDS?
Correct. In fact, there are two important questions in this. What is AIDS? What is HIV? So HIV is just simple infection in the blood, which we find by testing. Okay, as you all know, there is an incubation period, then there is a window period. Incubation period means day of contact to the day of producing the symptoms. And the window period is one day of producing symptoms to the day of testing positive. So the window period for HIV/AIDS is 6 months. That is the reason why the blood transfusion is the one cause for transmitting the HIV. Because people will donate in the window period and then they transmit the HIV. So that's what I told you. So by that is now aborted. That can be stopped by testing for the NAT, nucleic acid amplification testing. So by that way, we are reducing through the blood transfusion, we are reducing the transmission of HIV like anything. Okay. So now coming to the point of what is HIV and what is AIDS. So this HIV, if not detected or if not treated, it will progress to AIDS. So what do you mean by AIDS? So here, the human immunodeficiency virus, the HIV, means it reduces the immunity of the host. That means whoever is infected, it reduces the immune defense mechanism. So the HIV attacks the police department of our body. So the police department of our body is nothing but the CD4 cell. The CD4 cell is nothing but the cluster designated T lymphocyte. So this T lymphocyte orchestra is there, and that is attacked by the HIV. So the number of CD4s will be dying day by day. So that means once you test the CD4 count, the CD4 count, which was supposed to be normal at the level of 1000 or 800, it falls down to less than 500. So less than 200 when it falls, it is called AIDS. So now you understand what is the difference between HIV and AIDS. So AIDS is a syndrome. HIV itself is infection. So in that AIDS, during that period, that means when the CD4 is falling down, all the immunity is lost. So the person develops a lot of opportunistic infections. What do you mean by opportunistic infections is the infections will take an opportunity. Generally, you don't get some fungus in the mouth, but as the immune compromise is there, that means immunodeficiency has set in, the fungus will take the advantage and it will infect the mouth. Okay, like the esophagus, that's the throat and etc. So that is called opportunity taken by the viruses or bacteria. So opportunistic infection or fungus. So opportunistic infections. So all the opportunistic infections will be setting in step by step. Suppose let us say the CD4 count is 500. That means below 500, you are almost going into the immunocompromise. So below 500, that is the cause. You get recurrent sinusitis. General infections you will get, but recurrent. That means sinusitis people get, but more times they are getting means think of immunocompromise. So similarly in bacterial pneumonias they get. So similarly tuberculosis they get. So below 500 to 200, those are the diseases which we can identify in a HIV positive person. Nextly, if the person is going into further progressing to AIDS, then the CD4 is falling down to less than 200, then it is likely that they can be getting infected with a fungus, like what I have mentioned, oral candidiasis or esophageal candidiasis. Then they are likely to get a pneumocystis carinii pneumonia. Instead of routine bacterial pneumonia, they get another sort of pneumonia, which is quite rare, which we don't see. We see only in cancer people, we see only in organ transplant people, where there is immunocompromise again. So whenever there is immunocompromise only, you get that particular type of pneumonia. That is called pneumocystis carinii pneumonia or pneumocystis jirovecii pneumonia. So the next step, they get toxoplasmosis. Toxoplasmosis infection is not seen nowadays, never seen, but it is now seen with the advanced immunocompromised people. And later to that, if the CD4 falls below 550, I have told you about below 200, now I'm talking about below 50. So you get tumors in the brain, that is called lymphoma, lymphomas in the brain. And all the fungus will spread in all parts of the body, not only to the mouth and esophagus. That is called disseminated fungus. So disseminated histoplasmosis, disseminated cryptococcosis, disseminated coccidiomycosis, and disseminated cytomegalovirus infections. And then you have CNS malignancies, that is cancers of the brain. So in this regard, if you encounter a patient at this last stage, I don't think all these infections can be tackled easily. So that is the problem. So there cannot be any cure. What do you mean by cure in HIV? HIV is with the available antiretroviral therapy. Now we have more than 30 types of different varieties of treatments. That means medicines. So they can be given for cure. In the cure, in the sense, it is a functional cure. You cannot eradicate HIV positive from the person. That means the virus stays in the dormant form. So the person will be always positive, all through the life. The going into negative is not possible as far as HIV is concerned. That has happened in 2 or 3 individuals. That is a different scenario, okay, by itself.
Yeah. Okay.
But for all practical purposes, as now HIV, we call it as a medically manageable problem, we say there is a functional cure possible in HIV. So the early, the best. So we don't wait for treatment. Suppose once the patient is now positive, earlier we used to say that let the CD4 fall down to 200, then we'll start the antiretroviral therapy. But that's not the scenario now. We would like to start the treatment as soon as possible. We wanted to prevent all the possible opportunistic infections. So we don't want all the opportunistic infections to set in. Okay? So that functional cure can be achieved at the earliest itself. So with the least opportunistic infections itself, we can get a functional cure. And with advanced HIV, difficulty to treat cytomegalovirus disseminated disease or disseminated cryptococcus is very difficult. Disseminated coccidium is very difficult. So we cannot assure cure or functional cure at the moment. And one more point I would like to highlight as far as the HIV and conversion to AIDS or progression to AIDS is concerned. There are 3 types of progressors. As I have mentioned you, they take a long time to go into opportunistic infections and then CD4 falling to less than 200. So that is the nature of a typical progressor. And whereas a rapid progressor takes only 3 years, he will rapidly progress. That's from, let us say, CD4 is 1000 and now falling down to 200 in a rapid course. They are called rapid progressors. And there are that is amounting to 5% only. Similarly, there are long-term non-progressors. They progress, they very slowly or never progress, almost. So they amount to 5%. But 90% of people typically progress. They are called typical progressors. They take 8 to 10 years. So in other words, a person who is infected today, in 8 to 10 years, he will go into AIDS stage. That is the typical presentation.
Yes.
So I meant what is meant by functional cure, I have explained you. Okay.
So now that we see that how serious this problem could be, once you're infected, you won't be able to discover this for a longest time. And during that period,
correct, you're right.
You'll be, worsening your own immunity, finding out opportunistic problems in your body. And since it is so serious, so there should be some way to prevent AIDS. And that would be my next question to you, sir. Is there any way to prevent AIDS? Kindly elaborate on that. We should be actively working on that rather than, cure. Prevention is always better. Sure.
You're right. You're right. Here we have to consider ABC for the general public. For the professionals or for the other risky population, we have to tell about other things. ABC means abstinence up till marriage. B means be careful. We don't have any sex with a stranger. And the C is use a condom. Okay, these are the ABC standards for a general population. But as far as risky population is concerned, or as far as the doctors and nurses are concerned because of accidental needle prick injuries, and some people are having risky behavior. And see, there is what is called spontaneity of sex. So every creature in this world, they have a spontaneity for sex. They don't have a lot of idea about what sex is and why we want some progeny or anything. But it is the determined genetic feeding or whatever feeding to the particular organism that they have spontaneity of going for a sex. So that is the main reason why people cannot implement things. So knowing is vaccine. Know about the transmission method, know about how HIV is transmitted is a vaccine. But implementing the knowledge is the important thing to prevent HIV and AIDS, to stop. So here I told you about how it is transmitted. So everybody know it, but they have to implement it. That means how the implementation goes is number 1 is using condom. Number 2, I told you ABC. So the 3 C's I'm mentioning again. And the other one is we have to take PrEP or PEP. PEP means post-exposure prophylaxis. If there is an accidental injury, the doctor is the patient is in a serious condition, the doctor has seen this emergency, and unfortunately his gloves are torn and he has a needle prick, and then he has to take post-exposure prophylaxis. So that is called golden hour of opportunity. That's the golden time of opportunity. That is, immediately 2 hours after the prick, if he takes the medicine, then he will not get the disease. That means with the lowest viral load, we have regimens. We have a basic regimen, we have an extended regimen. Okay. So based on that type of source code and exposure code, we can suggest the type of regimen what we want. Suppose there is a surface spill of blood, nothing happens. Suppose there is a cut on the finger and there is a spill of blood, something happens. So the source is known. Is it a superficial or deep? By that we will classify. And we will classify and we either give a 2 drugs or 3 drug regimen. Okay. So this is called post-exposure prophylaxis. Some people ask for pre-exposure prophylaxis. So pre-exposure, and this also is seen in young people who are lovers or some having some affair. They go for a spontaneous sexual act, which we cannot, they are not able to prevent. So such people ask also for post-exposure prophylaxis. We do suggest that. The other one is PrEP. PrEP means knowingly they get indulged. So that is before exposure, they wanted to take the medicine. So that is also available. That is called pre-exposure prophylaxis. So these are the ways to prevent either accidental or routine or wantedly prevention or, for the general society who are ignorant. Yeah.
Right, sir. And that brings us to the end of this interview. We have the last question for you before we let you go.
Okay.
Sir, people have always been, dreading AIDS for now decades and years. Is AIDS a death sentence?
Yeah, it's not so. So once upon a time, like I told you, as far as 1986 to 2000 is concerned, that time people used to think there is no cure for AIDS, and then people used to commit suicide or sometimes homicide also. They used to kill their own family and they used to die. So that was the scenario. They think that HIV positive is a death sentence, but that's not the case today. Today, it is now a medically manageable condition. In allopathy, we have only few diseases which can be having a cure. For example, you have a cure for TB, leprosy, malaria, typhoid, etc., etc. Not so many. But you don't have a cure for BP, sugar, arthritis, asthma, spondylitis, whatever. So they are called medically manageable. You can medically manage asthma. There is no cure for asthma. You can medically manage diabetes. There is no cure for diabetes. You can medically manage, this hypertension. There is no cure. Yeah. So similarly, HIV is also medically manageable. There is no cure. But in fact, it has a functional cure. So I told you what is a functional cure. When the CD4 is it's near to the normal and viral load is not detectable, that is called a functional cure. So functional cure can be achieved at the earliest or even in the late, but not advanced stages, as I have mentioned you, because we cannot manage the opportunistic infections, cure them. So in fact, HIV/AIDS cannot be cured at that moment. Yeah. So now HIV and AIDS is not at all a death sentence. And now the incidence is coming down, but despite that, there is every risk because the risk populations are always there. And we are having risk population coming into the general population. So only once you say earlier, you used to think that only truck drivers, prostitutes, etc. only they will be having this problem. But they are having their own families and they are communicating with their families, and those families are also having multiple partners, and that is how it is spreading into the community. So, but everything is checked with the help of condom, as we have seen the good results. And nowadays the incidence has come down, but it should be, but people do not know, now forget about it. All the students also, all the young people, adolescents and young people, they have totally forgot about HIV and AIDS. So that should not be the situation. We have to revive them. Again, we have to give a good awareness.
The 80s, I think 80s were the prime time when, there was so much IAC, there was so much coverage done by government. And there was awareness for everyone. And that's the reason I think that fear of, contracting AIDS was so much bigger than actually, going through this disease, that people had actually stopped doing those, unsafe practices. So I think the youngsters of today, those who are, in the new age, the millennials kids, they are into
Yeah.
premarital and, postmarital, so many
Yeah.
affairs and, relationships that they're keeping.
Yeah.
I think the best
Yes.
thing would be to revive this fear into them again, and,
Yes. Yes.
just
That's
to
what.
arrest, so that
Yeah.
they know it is a manageable disease, but it is not something that would be good for you or your family or your
Yeah.
loved ones. So we should
Correct.
abstain or, prevent it as much as we can. So thank you
Yes.
so
Yes.
much for joining us today, Doctor. It was
Okay.
lovely meeting you.
Yeah.
And you have been very, very explanatory, very informative. So it
Okay.
was our,
Thank you.
great pleasure to have you here with us today. Thank you so much, sir.
Thank
Thank you.
Thank you. Thank you.